No, God, Sharir and Kala and Marma, and that's so good. Sounds so nice, but what do I do with it? And if you don't know more about it, that's exactly when you will start creating doubts in your mind that what am I doing here? And this next class, what we are doing today is taking it to that level where you're actually seeing that everything what I have learned in the last year in the AWC class, how I can apply it into doing something which will create more tools for me to understand the person, more assessment tools. That assessment will boil down to some information that you will make connections to yourself, and then you will create a plan. So when you go to a modern medical doctor and they ask you to do some blood work, and they look at your blood work and they see that, oh, you have anemia, you have morning Kadi, you have anemia, or your hemoglobin is low. The moment they see something which is there, you have to come up with, what do I do with this person so that I can allow this iron levels to improve, or this hemoglobin levels to improve. Or if they see that the cholesterol levels are too high, then they will have to come up with a plan that what do they need to advise this person so that this becomes less, because it may not be a disease, but it could be potent enough to create a disease down the road. So when you are talking to a person, and even if you are looking at someone's body constitution, that this is a Vata person, he is lean and thin, he is too anxious, he is unable to handle everything going on in his life, he is having some sleepless nights, he feels all shaky and jittery. What do I do with this information what I got so that this imbalance doesn't really escalate to a level where he creates a disease, and the treatment of the disease, if it is not connected with who that person is, how his response to a given situation is. Hey, good morning, Raji, come on in. And how he is actually managing that thing, it will not really work, because that insomnia doesn't need a tranquilizer pill. It doesn't need, and it won't work that way, because it has to be based upon your ability to understand two things. And that's, I would say, one of the most unique feature of classical Ayurvedic diagnosis. And those two pillars, which are called as Rogi Pariksha and Roga Pariksha. And that's what this class is all about. So what we're going to talk about is the classical Ayurvedic diagnostic techniques and patient assessment techniques revolve around these two key terms. And these terms are very, very, very important. So I would